Good evening. Welcome. Greetings. And we're so glad you joined us this evening for this very important and we hope critical information to share with you this evening. I'm Yolanda Russell. We want to welcome our Facebook, Twitter, and YouTube audience. I'm going to be your moderator for this evening. I'm Yolanda Russell. I didn't say my last name. I'm Yolanda Russell, and I am the president for the Florida Democratic Senior Caucus. So, welcome again. We want to let you know that we have a wonderful group assembled here for you to give you some great useful information, especially focused on issues for our senior community, Medicaid, Medicare, Social Security, price of prescription medication, and voting by mail.
Yep.
I will quickly let you know that I know I don't look my age, but I am 66 and I have been voting since 1972. I have never missed an election. I think it's the most important thing we do as part of a democracy. So we will talk to you about the opportunity to vote by mail during our time today. I want to start by letting you know if you are in our audience on YouTube, Twitter, or Facebook, you'll probably want to send us some questions. We will be watching for your questions, and as we are able to later on in the panel discussion, we will get to your questions. So, thank you very much for participating at that level. I want to start by introducing this panel to you. I'm going to start with the chair of our Florida Democratic Party, Terry Rizzo. Welcome, Terry. It's so good to
Well,
see you.
thank you, Yolanda. It is so great
How
to
are
be here.
you?
I am just great, thank you, and very excited to be with you and with this marvelous group of people to discuss this really critical topic. I want to say good evening, Florida Democrats, and thank everybody for joining us tonight. And I am Terry Rizzo, the chair of the Florida Democratic
Terry, I
Party.
can't hear you. I'm sorry.
You
I'm just
can't?
letting them know.
Can
I,
you all hear me?
I
Can
hear
everybody?
just
Yes,
fine.
it's so good to
Okay.
see you.
Thank you, Yolanda. It is so great to
I
be
can't
here.
hear
I
Terry.
am just great, thank you, and very excited to be with you and with
So,
this
welcome,
marvelous group
Terry.
of people to discuss this really critical topic. I want to say good evening, Florida
Is that better
Democrats,
now? Can
and thank everybody for joining us tonight.
no?
And I am Terry Rizzo, the chair of the Florida
Can
Democratic
you hear me,
Party.
Terry?
No, I don't know what's going on.
I
Something's
can't hear
playing back.
Terry.
What I was going to say is that I'm a proud senior myself, Yolanda, and I got a few years on you. 65 is the new 45, and 70 is the new 50. I'm especially grateful to everybody else on who is on this panel for taking the time to be here with us to discuss this critical, important issue. Thank you, Yolanda. I want to thank State Representative Wengay Newton, who's here with us, Rudy Engholm, and John Bowser Bauman, John Bowser Bauman. I call him Bowser, so I'm going to slip and do that all the time. Longtime friend, and I want to thank you for joining us tonight. I want to say it cannot be understated, absolutely not understated. There is so much at stake in this election, and that is especially true for seniors. Now, more than ever, we need a president we can trust with our health and our health care. And Donald Trump has proved he is not that person. He is not looking out for our safety and well being. And let's be clear, the coronavirus has impacted every single American in one way or another, but tragically, the senior community has been particularly vulnerable to COVID-19. Trump has failed seniors in so many ways in Florida and across the country. Though it's obviously a global pandemic now, it didn't have to be this bad in the United States, one of the richest countries in the world, and that literally had an existing playbook on how to deal with a pandemic, which Donald Trump threw out the window. Simply put, and everybody knows it, Donald Trump ignored the experts. He failed to prepare, and we are all paying a steep price for his mismanagement and inaction. And what's worse, Donald Trump isn't learning from his mistakes. It's been nearly 70 days since he said anyone who wants a test can get a test, and that is still not true. Though coronavirus is clearly the most urgent threat to our health, Donald Trump showed us we can't trust him with our health care long before this all erupted. He's played political games with our Medicare and Social Security, and from day one, he's attempted to repeal the Affordable Care Act. And we're going to be talking about that as we go through. Seniors are a powerful voting bloc in Florida. We have the ability to sway this election. Trump has failed us, and it's now our turn to be the reason he loses Florida to Joe Biden in November. It's game over. If we win in Florida, Donald Trump cannot win the White House. So we need to come out big for Joe. Joe's a leader we can trust and the president we need in the White House to ensure that we're safe and healthy. So with that, I'll end and look forward to the discussion tonight with all of this marvelous group. Thank you, everybody. Can everybody hear?
Yeah. Yes, I think Yolanda is
Yeah, yeah.
Yolanda.
I think
Yolanda may not have audio.
She's
I can hear you now. It just came on all of a sudden.
Okay. A little bit of audio time.
Can you all hear me?
Mm-hmm.
Yes.
Okay, let me go on. Terry, did you move us forward in this?
I talked about it, but
I can't hear Terry.
Actually, I think
I hear Dawn, but I can't hear Terry.
Yeah. Shall we go on to the questions? Yeah. 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 Well, I know one of the things we wanted to talk about was the Affordable
The
Care
next
Act.
person we have on our panel is State Representative Wingate Newton. Welcome.
Hi, how you doing? I'm State Representative Wingate Newton, District 70, which encompasses Hillsborough, Manatee, Sarasota, and Pinellas. I'm finishing out my second term in the Florida House, and we have a lot of challenges facing us, and we have got to be on point for our most vulnerable populations, which is our seniors. We're truly standing on the shoulders of giants. These are the individuals that paid it all. They went first to make sure we can enjoy the lifestyles that we have. So it's only right that we make sure that we look out for them and provide for them in their golden years, as you would say. And that encompasses a lot of things, and we have got to be making sure that we're crafting legislation and funding things that can help them with the rest of their lives. And that's what I'm all about. And I'm happy to be a part of this panel. I think Yolanda has a delay.
Yeah, I think she might.
Can you hear me, Yolanda? Oh, we just lost her.
We just lost her. Well, at that point, thank you, Representative Newton. I'll just go ahead and jump in so we continue on. I'd love to welcome Rudy Engholm, who's with us. Rudy's an attorney. And Rudy, would you tell everybody about your background and what we're going to discuss? Thank you. Thank you for joining us tonight.
Thank you very much. I live in Lake Wales, Florida. Most of my career has been actually in law-related things. I practiced law back in the Northeast in the late 70s. And most recently, I've become a Florida Supreme Court certified mediator. I really love the idea of bringing people together.
Well, thank you. We're thrilled to have you with us tonight to join in the discussion. And is John Bauman here? Now, John's joining us from California. He's, I think, temporarily off, but we'll introduce him when he comes back. And I think we've lost Yolanda temporarily. So one of the things we wanted to talk about was the Affordable Care Act and Medicare, which is really, really critical. Is John Bauman here? You're hearing feedback. Representative Newton, the Affordable Care Act allows Medicare beneficiaries to access recommended preventive services for free. How important is this for seniors? Is there a concern for rising healthcare costs for seniors if the Affordable Care Act is overturned, as we know Donald Trump is trying to do?
I would say yes, Madam Chair. It's even in the words of the bill, affordable health care. And that's making it affordable so people can afford to have good health care and access to health care. As you know, most of our seniors, not most of them, all of them live on what we call a fixed income. So they don't get a 10% raise or 5% raise, or some of them don't even get a cost of living increase. So any variations in their monthly costs is going to be catastrophic to them. If you look at it as it pertains to prescription drugs and them having to have some life-saving medication, then if the price increases, then they got to decide whether I pay for my medication, do I buy food and eat? So these things are very critical. The Affordable Health Care Act, the Affordable Care Act has provided that security for them to be able to not have to worry about that fluctuation. So we have to make sure that that safety net is there to help them.
And we talked a little bit. As one of the important things is the donut hole and the coverage that the Affordable Care Act did with the Medicare, closing the donut hole and saving on prescription drugs. I know that Medicare, everybody or most people who are seniors and are on Medicare know that there are several parts to Medicare. A is the inpatient hospital coverage. Part B is outpatient medical coverage, and Part D is the prescription drug plan. And the ACA did a number of things, correct, to help lower prescription drug costs for millions of Americans by helping close that donut hole. As we know, many seniors have multiple drug prescriptions, and a lot of medications are really expensive. So the donut hole is a limit that the plan pays. When you enter the hole, you have to pick up costs yourself, and then until the hole closes. And so as I understand it, and taking a look at the statistics, from 2010 to 2016, nearly 12 million Medicare beneficiaries received discounts on prescription drugs because the ACA started the work of closing that donut hole. So if Donald Trump is successful in throwing out the ACA, 12 million seniors plus will have to pay more for their prescription drugs. Is that correct? Yeah. Right. And then the ACA also prevents Big Pharma, what they call the Physician Payment Sunshine Act, prevents Big Pharma from paying doctors behind closed doors for prescribing their drugs, and saves seniors money, and prevents a conflict of interest. That's another benefit from the ACA. And the third way is that the ACA helps lower drug costs is through the Biologics Price Competition and Innovation Act, which allows the FDP to approve cheaper alternatives to biologics. So in many ways, the ACA is helping seniors by keeping prescription drug costs down. And if it's overturned, then people will be vulnerable to rising costs, correct? Yeah.
Correct, Amanda.
Anything else that you can add to this?
Well, I would just say that, like I said, this is our most vulnerable population. And when you operate on a fixed income, any discrepancies, any anomalies is going to blow you all out of whack. So now you have to make sacrifices. That's why when I served on council, I was a staunch advocate against the red light camera program. Because what happened was we had a lot of our seniors getting tickets for turning right on red. So when they got a ticket in the mail for $151, they would have to pay it because they were afraid that if they went before a judge with their being in their golden years, with a ticket, that they would take their driving privileges away. So it was almost like it was extorting money out of them. So you have to have these protections in place to protect our most vulnerable. And that's what the ACA does. And that's why we have to fight to make sure that protection is maintained for our most vulnerable population, our seniors.
Yeah. Rudy, did you want to add anything to that? Or?
I'm really here to talk about voting and coronavirus and some of the things later on. So.
Okay. Prescription drug costs is a major issue for the seniors. Joe Biden has specifically laid out a plan for how he would reduce drug prices for Americans. And why is it important to repeal the rule preventing Medicare from negotiating the drug prices? That's a question that was asked by someone in the audience. Why is it important to repeal the rule preventing Medicare from negotiating that prevents Medicare from negotiating drug prices?
Well, I mean, just in the question itself, preventing them from negotiation.
Yeah.
Which means you have no say in how much you're going to pay. That's what negotiation is all about. They should be able to negotiate for a fair price. And if you prevent that, they get to pay whatever they want to charge, and that in itself can bankrupt the whole thing. So they should be able to go and negotiate for the best price, just like you do. That's why they call it shopping, not spending money. So you have to go out and shop, and that's what negotiation is. So when you try to block access for someone to negotiate on behalf of our seniors, then you're going to have rising costs. You can't control the cost, and you also can't benefit from any savings that you may have got negotiation, and that's why it's bad.
There's the question has to. I understand 4 of 7 in nursing home residents are covered by Medicaid, which is another component that's very important for seniors. And the question was asked, why is it important to expand Medicaid in Florida? I went straight to a source that I trust very, very dearly, which is Karen Clay, who is the president of our Florida Democratic Disabilities Caucus, and she's herself a senior, and she's very familiar with Medicaid expansion. And her answer is Medicaid expansion would benefit seniors and individuals with disabilities, not just seniors, but all individuals with disabilities, by providing access to preventive physical, behavioral health, and long-term support and services. And I think we all know that, or maybe people don't, but 1 in 4 people in the United States are people with disabilities. 1 in 4 of every voters, I should say, 1 in 4 voters are persons with disabilities. Expansion would streamline eligibility renewal provisions to age and disability rated pathways, which can help retain eligible people in coverage and strengthen their continuity of care. And especially important, Medicaid is an essential source of coverage for medical and long-term supports and services. LTSS, which can ensure individuals remain in their homes and communities, enabling seniors to choose to receive their care at home and preventing nursing home or any congregate situation, especially now under the circumstances with the issues going on in nursing homes. This is expanding Medicaid would enable more seniors to receive more coverage at home, which is really critical. It's really important. Anybody want to? Yeah.
I got one word for that: 800,000. That's the amount of individuals with access to healthcare, just having access to healthcare, and the hundreds of millions that we would save. Think about it: our most vulnerable population and our homeless right now, their primary care position is the ER room, the most expensive place to receive medical care, because they don't have access to preventative physicals and things like that. So they wait until there's absolutely a necessity, be it coming in there gravely ill, or coming in there from a 911 call where we have to mobilize all of our first responders to pick them up, save their life, and then bring them in. So it's important that we look at ways that we can expand it, because by expanding it, you take the burden off of all of our ERs, the most expensive trauma care being there, when you can do preventative, because preventative will prevent you from going in there. But not having to expand it, you block access to over 800,000 people to have health care in this state.
Yeah, John, so 800,000 people are being affected by the lack of expansion of Medicaid here in Florida. We're just talking about why Medicaid expansion is so critical, especially now with so many people, who need that coverage. And this would help expand home care as well. So welcome back. I'm glad that you're back.
Back. I don't know. I think I lost my connection somewhere.
Yeah, wow.
So I moved my location. We don't have the piano anymore, but we'll figure out something.
Okay, we'll figure something out. Yeah.
I do want to add to that, that in all my travels over across the country, more and more people. I've got my grand dog in the back now.
I love it.
Which I didn't have before. Leon.
Leon.
We're in a very important meeting.
That's right.
He's a grand dog. I don't have very much control over him.
Yeah.
So what I do want to add to this is that most people do not understand, but are beginning to realize that Medicaid pays for literally 2/3 of long-term care in America. That's the actual number.
Okay.
And that affects every family, one way or another. This is, the old perception of Medicaid is really a thing of the past. Medicaid is about everybody. It's about every family, because the average cost of nursing homes in America is $93,000 a year. So it's very important for everybody to realize how critical Medicaid is, and consequently, what Florida is doing to its own citizens by not expanding Medicaid.
And I can also add to that and tell you that not expanding Medicaid also, it helps us create more doctors for the rest of the country. And what I mean by that, and something you may not have known, is that our the residency care program, the residency program in our learning hospitals, the majority of that money is provided for with Medicaid. So by not having funds for that, the people, the doctors and that were graduating and the surgeons, they cannot do their residency here. So they'll go to California, they'll go to Chicago, they'll go other places. And then when they're done with their residency, they will stay there. So that would also help us expand the residency program for the doctors that we're creating to stay right here and provide the healthcare that we need for our citizens and our seniors.
That's an excellent point. Representative Newton, what is the subcommittee that you sit on in the House? I meant to ask you before to tell it.
Yes, yeah. I serve on, I'm the ranking member on Business and Profession. I serve on the State Affairs Committee. I serve on Children, Family, and Seniors.
That's the one.
Yeah.
Yeah.
And I serve on Higher Ed Appropriations.
Absolutely. And that's so critical, because anything that affecting seniors would be coming through you. And has the issue of Medicaid expansion come up at all?
No, that's barely raised. As you know, we're the fearless 47 that's in the back row in the chamber.
Yeah.
And most of our committees, we're outnumbered 15-5. It's 20 members or something like that. So the only thing that's coming up on the agenda is bills that are filed and bills that get agendaed. So the majority, the prevailing party controls that agenda. So a lot of that stuff about Medicaid expansion probably they wouldn't even make the cut. It's probably as popular as putting a gun bill up. Need I say?
It's virtually criminal.
Yeah.
Virtually criminal that Florida does not have Medicaid expansion.
I know. And that is exactly why we need to elect more Democrats up to Tallahassee.
There you go. I was just gonna say.
We're going to talk about that too, because that's really critical. Because in order to make effective change, we have to not only get Joe Biden elected on the national level or elect Joe Biden to deal with it, but we have to also elect Democrats here in Florida to deal with Tallahassee. Yeah, so that's good. John, thank you. I'm glad you were able to come back, because we're talking about one of the so-called entitlements, which is Medicare, and it drives me nuts. I have to say, entitlements. I mean, in the scheme of things, I guess in the technical term, it's something you're entitled to, right? If you look at these programs, Medicare and Social Security.
They're earned benefits, entitlements.
Yes, thank you. Yes.
The language wormed its way into legislative language on the Republican side.
I know.
Purposely. And, it's because they're referred to as that E word so frequently in actual legislative language.
Yep.
It gets picked up by everybody. And it's one of the things that bothers actually not just Democrats, but independents and Republicans are bothered by these programs being referred to as entitlements. Social Security and Medicare are the two most successful domestic programs in the entire history of the United States of America.
Exactly.
And they are earned benefits. People have paid into them for their whole lives. And this is something that they've earned and that they deserve.
And that is why I think all of us as an entire group should stop using the word entitlements or object when people say it and say they're not entitlements, they are earned benefits. Now, you're entitled to them, but they're not entitlements, correct?
Well, I never even gathered that thought about entitlements.
Yeah.
They were entitled to take it out of your paycheck.
Yeah, there you go.
How many people can opt out of Social Security? I'll wait.
Entitlement was meant to be pejorative.
Right.
Exactly. And they turned it into a pejorative term.
To be negative.
Yeah.
You pay into it, and it should be there for you when the time comes. And unfortunately, that's not the case. And it's not an entitlement when they're taking the money. I mean, entitlement is something like my kids. My kids, they entitled. They expect to have a brand new car in the driveway when they turn 16. That's an entitlement.
That's an entitlement.
Nothing. But if you're working and they're taking FICA and Social Security out of your paycheck, you can't opt out. So you're paying into a system. So the least that system can do as you paid into it is help you in your time of need when it comes time for you to take those earned benefits that you paid for.
Well, one of them, I think so. So all of us as a group and everybody listening, let's stop using the word entitlement and let's use the term earned benefits, right?
Right. We have 5 questions in our questionnaire for candidates at Social Security Works PAC. Will you protect and expand Social Security? Will you protect and expand Medicare? Will you support Medicaid expansion as defined in the Affordable Care Act?
Right.
Will you fight to lower drug prices, which I think we're about to talk about?
Yep.
And number 5, will you always refer to Social Security and Medicare as earned benefits and never use the term entitlement?
Well, let's go to that then.
I wouldn't even say earned. I'll say paid for benefits.
Well, there you go.
Earned benefits is kind of what we have agreed on as a society. So we should just be
you're not earning them when they're taking the money when you're paying for them.
Yeah, you're paying into it. Yeah.
I mean, you're right, but
I mean,
Yeah. Well,
earned benefits is the language that everybody prefers to use to work on senior issues.
I understand.
Exactly.
I concur. Anything but entitlement. And there's it's not an entitlement program. Not
the
that.
E word, we'll call that the E word. It's
Right.
Okay. Well, he's promised to. So in terms of that, how would Joe Biden strengthen this in terms of?
Social Security.
Yeah. Yes. The Social Security. Right. The other earned benefit.
Right.
I don't know whether we're going to go to drug prices first or the Biden plan for Social Security. Now, listen, we are an advocacy organization at Social Security Works. We fight for Social Security. I do have to say, we are really, really happy with Joe Biden's Social Security plan. It is really excellent. People who are looking for real change are going to find it in Joe Biden's Social Security plan. He has embraced. There are 5 points to it, so I'm going to look down so I make sure that I can remember all of them. But if you look on the website, they're all right there, and all of them are really good. This is a quote from the Biden plan. It includes, quote, asking Americans with especially high wages to pay the same taxes on those earnings as middle-class families pay. That is the cap.
Yeah.
Right? A lot of people don't know about the cap, that you don't pay another cent into Social Security after $137,700 of income.
Regardless of how high you go. I mean, you could go up to,
It doesn't matter. You could be a Koch brother. You stop paying at $137,700. So what that means is the average person who's making less than $137,700 is paying 6.2% of their wages in. And a Koch brother who made $50 million last year is paying 0.0000000000001% of their income in. How is that fair to Americans? Okay, well, the Biden proposal, is that we are going to do something really big about the cap. Now, there are all kinds of proposals out there. That try to make there's a John Larson's bill, which we like, is Social Security 2100. That has people paying, it keeps the program solvent until 2100, has people paying in starting at 400,000 again. Middle class incomes, even Bernie Sanders' plan is 250 and up. So scrapping the cap is really a pretty serious matter because, it depends on how you define what's a middle class income. But I got to tell you, Joe Biden's language is firm and strong about doing something about the cap. That is a big deal. Higher benefits for older Americans. Those who've been receiving retirement benefits for over 20 years. This is a big point. Their resources are dwindling. Very strong in Joe Biden's plan. Minimum benefits, changing the minimum benefit. Those who have spent 30 years working will get a benefit of at least 125% of the poverty level. Minimum benefit has deteriorated at this point in history to the point where it's not really effective. Very important. Protecting survivors' benefits is point number 4. Widows and widowers' benefits being protected from steep cuts. The Biden plan is to raise their benefits by 20%, which is a big deal. And finally, what's called WEP GPO, and this is a specialized thing, but I hear about it on the road all the time, eliminating penalties for teachers and other public sector workers who in the 1983 adjustments to Social Security, what was called WEP GPO, they have not, if there's a conflict between Social Security and their pensions or a conflict between Social Security and their union benefits, they have not been receiving their Social Security benefits, and it's something that people complain about all the time. It really is unfair, and Joe Biden's proposal is to make big changes or ultimately eliminate. It really is to eliminate actually WEP GPO. So all of these are good. All of these are strong. All of these are powerful, and all of these are really, really progressive.
Yes, and they're not cutting it, which is the case for Donald Trump. They're expanding it.
Forms of expansion.
Yes,
but they're
exactly.
all really good.
That's right. Compared with Donald Trump, who of course wants to minimize and privatize, particularly some of the other things, and particularly turn people into more private medical plans. When it gets back to Medicare, talking about Medicare. Yeah.
Look, the whole thing with Donald Trump, let's
Yeah.
just be really honest about it. It's a con.
Mhm.
He's a con artist, and this is a con scheme.
Mhm.
When he ran, and we all welcomed this when he ran and said, "I'm a different kind of Republican," unquote. "I'm not going to cut your Social Security and your Medicare." But it is a con scheme.
Mm.
Every proposal that has come up, and we'll talk about drug prices later, same thing. He says he's going to fight to lower drug prices, but when a bill passes in the House and of course dies in the Senate,
Yeah.
right, it's also clear that Donald Trump is going to veto it.
Yeah. Yeah.
Right. So all of it is just rhetoric. It's nothing but rhetoric to head fake people into thinking that this guy is going to try to do the right thing, but he has absolutely no intention of doing the right thing. There is no Social Security expansion plan on the table from the Republican side, none whatsoever. They just want to cut and privatize it like always.
That's right. And in terms of this, and Joe's plan for the prescription drug companies to bring prices back to our first question, in terms of percentage, Wenge, do you have some some about this? And I know John, you do too. You can tag team that. Yeah.
Well, I mean, we talked about the having the ability to negotiate.
Right.
You need to be able to do that. That's what it's all about. I mean, if you can't negotiate for a price you're paying, that's like shopping.
Right.
You have to go out and get this car because this is the only car they got. And the car costs $50,000. That's it. You can't go get another car that might be $25,000, which saves you $50,000. You know what I'm saying? Which you can do other stuff with, like feed your family or support the finer things in life. The problem is you have to be able to negotiate, and after negotiating, that's about equivalent to a no bid contract. So you're forcing people to take the price that we set, and there's no savings. It's all about, if you're looking at what Joe Biden is talking about, it's all about being able to negotiate, people paying their fair share, and trying to find the savings to help out for the ones who can't pay, because that's what's going to pay for that. All these savings that when we talked about originally crafting the Affordable Health Care Act, you used to go to the doctor, you would get 7 or 8 X-rays on the same arm. Everybody's ordering an X-ray or a workup on the same body. The body hasn't changed, but every test is costing, I don't know, $10,000, $15,000.
Yeah.
Now they have most of the stuff electronically because of the requirement of the Affordable Health Care Act. So they can access those records. So only one test is done. Look at all that savings. So he's all about looking at the system as a whole. How can we provide for everybody? Everybody should have access to health care. And that's the way you're going to do it. And that's how you have savings. But not being able to sit down and negotiate a fair price for prescription drugs is going to be a huge problem. I know it only helps the person that has the drugs and can charge what they want. If they're not forced to sit down and bargain or negotiate for a fair price for the end users, which are our seniors and the people who have to pay for those prescription drugs out of a fixed income.
Yeah,
but the income is not going to go up. They're not going to get a 10% increase because the pills went up 10%. They got to probably pay for it out of a little bit of money they got. So they got to either buy less medication, take less medication, eat less food, or do without, which is insane because retirement, to really look at it, it's almost 20 or 30 years of unemployment. That's what it is. You have to live off a fixed income, and hopefully it will survive you through the rest of your life. And we have got to make sure we look at every aspect to try to realize whatever savings that we can have, and not being able to negotiate that's huge.
John, do you have a quick point to add that before we go on to the big thing, which is voting? Talk to voting. Yeah.
This is a pretty simple national disgrace. Medicare is the largest purchaser of prescription drugs in the world.
Right.
Over 60 million Americans are on Medicare. So, and there is nothing standing between Medicare and the ability to negotiate better drug prices, but the United States Congress.
Right.
Nothing. It's as simple as that. We pay, by the way, with our tax money to develop, our tax dollars create these drugs, they develop the drugs, Then what happens is right now we give the patent to a corporation that turns around and charges the highest drug prices in the world. It's crazy.
Yep.
HR 3 passed by Democrats. It's been passed. It exists, and it changes all of this. It not only allows Medicare to negotiate, but also broadens it out to the population as a whole. It also, lower drug prices. It also adds dental, vision, and hearing to Medicare, which needed to be done a very long time ago. Democrats want to negotiate prices. Republicans are in the way. Trump wants to veto it. The bottom line is we need to bum 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 dang 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 ding dong ding lower drug prices now.
That's great. I love it.
Really simple.
I love it. That is just great. Is Rudy here? I can't see him if he's here, and I wonder if he wanted to jump in on any of this. But we're about to, and now I have it. There you are, Rudy. Did you want to add any of this? There you are. Hi. Did you want to add to any of this as we were going through in terms of Medicare or Social Security?
Nope. I'm confident you guys have covered it. I really want to talk about how to bring about the change that needs to happen.
Okay. Well, let's get to that. And before we do that, we are going to see a very brief video that our folks are going to be putting up now concerning vote by mail.
Hey, Florida Democrats. Thanks for tuning into the stream. I'm just going to walk you through on how quick and convenient it is to actually register for a vote by mail ballot. All you have to do is go to fl.dems.vote/mail, and you'll end up at this Supervisor of Elections directory that's been put together by the Florida Democratic Party. Once you land on this page, all you have to do is scroll down, and the first thing you'll see is some criteria that you need to meet in order to request a vote by mail ballot. So you need to already be registered to vote in the state of Florida. Then on this page, you can request a mail-in ballot online. After that, when you receive your vote by mail ballot in your mailbox, all you have to do is vote for Democrats from the top and all the way down to the end of the ballot and mail it back. So on fl.dems.vote/mail, you scroll down and you can find all the county supervisors of elections information. For my case, it's Orange County. So I'll scroll down to Orange County right here, and I will click Request Ballot Online. The next page that pops up will be the Supervisor of Elections online mail ballot request form. Each Supervisor of Elections website will look different, so it might not look like this one. But all the information is pretty much the same. All you'll have to do is complete all the information that is asked of you on this page. And at the very end, you'll have the option to review your information and finally click Submit. Once you're done with that, that's it. You'll get your vote by mail ballot. And from there, you just need to mail it back in.
Well, thank you, Ali. And if anybody has any questions, let us know afterwards. But you can go to the FloridaDemocrats.org website and do that. Rudy, you want to talk about why that's important?
Let me start with this, why this is the most important election in our lives. And against the backdrop of a pandemic, I want to talk about this president for just a moment, and then I'll go on to the actual voting. But do I see President Trump losing support among seniors because of how he's handled the pandemic and many other things? My short answer is I certainly hope so. But I don't think he's been honest with the American people. I don't think he's managed the pandemic well. I think Mr. Trump has put his interests in front of those of the country. He has not been compassionate. He's not taking responsibility. He blames everybody. And personally speaking, as the former vice president of a tech company, let's just say he would not be executive material at our company. And tragically, seniors who are in the audience are the people who are bearing really the brunt of this. And you've all seen the numbers. I think some the networks are not being very honest about that. The very best information I have, I think, is from the University of Washington site. But as of tonight, I looked them up just before this show, 1,437,000 coronavirus cases in the United States. 1,400,000 plus, 86,000 deaths. Florida, 43,000 cases, 1,800 plus deaths, 6% testing. And it doesn't have to be this way. There's other countries that have done much better than us, that have showed better leadership and early testing. And as a result, they have much better results in infection rate and deaths. My own family has been sheltering at home now for just about 2 months. And again, the very best data I can find from public health experts is that this thing is likely heading into a second wave. And we are planning on continuing to shelter at home until there's a plan to open. And Joe Biden has actually put forth a plan with 5 steps. I'm going to list them very briefly. Number 1, get down the number of new cases with continued social distancing. Get accurate, quick testing to trace. Get the hospitals ramped up with better equipment to be ready for flare-ups. Make some workplace changes to make the workplace safer. And finally, be ready to distribute effective treatments if and when they're available. So for all these reasons and a host more, this is a really, really fraught election. Here's something that's really interesting. Not too long ago, the Orlando Sentinel had an article and identified my county, Polk County, as one of 4 key counties in Florida that will determine whether Democrats win or lose the 2020 presidential race. And I've been told, and I believe it, that Trump cannot hope to win in November unless he wins Florida, just given the math of the Electoral College.
That's right.
And almost every key race has been won or lost in Florida by around 1% or less. So it's a really key swing vote. If there ever was an election that needs your vote, this is it. And I'm just going to touch very briefly on voting by mail and then let the others jump in. So voting by mail, first of all, there are 5 states that already do this. 100% of their votes are vote by mail. Colorado, Hawaii, Oregon, Washington, and Utah. They've shown that it can be done, and it's not, I mean, it's complicated logistically, but it's probably less complicated than maintaining the number of polling places in Florida's 67 counties, 1,200 and some precincts. It's safer. If you're a senior, you're in a vulnerable population, and you may be wishing you want to vote, but you didn't have to go to physically to a polling location. It's convenient. Turnout improves. It's more secure. Mailed ballots are harder to hack, and they have a really great paper trail. And by the way, this is really important now in terms of the legitimacy of this election, where we're worried about foreign interference, and no matter who wins, somebody's going to claim that it was an illegitimate election. Paper ballots will help prevent that. And finally, it's just simply safer than most polling place elections because the ballots are distributed in a very decentralized way. So other people are doing it. It makes sense. It's less prone to fraud. How do you do it? There was that short video a minute ago that led you through some website. I'm going to give you a different way to go at it. Because there are 67 counties in Florida, and I'm sure some of you are listening from every single county, I can't list 67 supervisor of elections phone numbers. So if you're already signed, if you want to vote by mail and register, grab a pen and a piece of paper. I'm going to give you a hotline number in a second. And this hotline is going to reach the Florida Democratic Party hotline. Now, these people are not going to register you to vote. I already talked to them and they said, please don't mislead people and say, we're going to do your registration. It's like a treasure hunt. They're going to point you in the right direction to your supervisor of elections. So here's the phone number. I'm going to repeat it a couple of times. 833-868-3352. Let me say it again. 833-868-3352. And that's the Florida Democratic Party hotline. They can give you the phone number of your local supervisor of elections. So you call you can go online, you can do it by fax, you can do it in person, but you contact your supervisor of elections and you ask to register to vote by mail. You have to be a U.S. citizen and you're a resident of Florida and you're entitled. Unlike other states, you don't have to have reasons, excuses, and so on. You can do it. You will get confirmation of your vote by mail status in the mail. and well before the next election, which, by the way, is the August 18th primary. And you want to, by the way, you want to do this now, as soon as possible. Go ahead and get registered to vote by mail. You're going to receive a ballot in the mail. And this primary is important because we've got at least one U.S. Senate seat up for grabs, all representatives, a number of statewide offices, attorney general, lieutenant governor, governor, etc. So you get your vote by mail, you complete the ballot, you have to sign it. More ballots are rejected for bad signatures than any other reason. It just seems a shame to exercise your constitutional right to vote, go through all the steps, and then forget to sign it. You need to do that. And you have to return your ballot by 7 p.m. on the election day. Personally, I recommend you do it way in advance. Mail it, drop it off at your local supervisor of elections, and by then they may even have collection points like some of these other states do. I'm going to give you that number again in case you just got your pencil. This is the Florida Democratic Party Voter Protection Hotline, 833-868-3352, and I'll let the others jump in, but personally I'm a big proponent of voting by mail. Apparently President Trump is too, because that's how he voted in the last election. So if he tells you it's a fraud and you shouldn't do it, I'm old enough to remember the watch their actions, not their words, school of thought.
And thank you, Ernie. That's exactly right. Trump did vote absentee, and we want everybody to do that too, and we all can speak to that. I look at a vote by mail ballot, voting by mail as or at least getting a vote by mail ballot, signing up for it as an insurance policy. We don't know what's going to happen in the August primary and in the November general election. Some people like to vote at the polls, and there may be poll voting. If so, and you have a vote by mail ballot, you can still go to the polls and vote. Your first vote counts. So, you don't vote by mail, you go to the polls and vote. That's the one that counts. You can turn your ballot in and vote live if it's available. But if it's not, you've got your vote by mail ballot as insurance. We know that people who have a vote by mail ballot vote in substantially higher percentages. The turnout rate for vote by mail is in the 90%, and the turnout rate for people at the polls typically is in the 50 to 60%. So consequently, more people vote when they're voting by mail. It's easier for people to vote for all kinds of reasons. Secondly, the other huge advantage, Representative Newton, I think you'll attest to this, is people vote down ballot in greater numbers when they've got a vote by mail ballot. They've got more time to think about it and do their ballot instead of just running in and going to the polls. So that's an advantage too. And they are counted, as people watching may not realize, especially if they're coming from another state, that the vote by mail ballots are counted, and they're the first ones counted on election night. It's not that they're provisional ballots; they are actual ballots that are counted, and they're counted first. So all of that is important to talk about. Look at it as an insurance policy. We want everybody to sign up because we want everybody to be able to vote safely and securely. And if John or Representative Newton, do you have anything else to add on that?
Here's a great piece of news for Florida. Number one, we win Florida, we win.
That's
we win seniors in Florida, we win.
Mm-hmm.
And Polk County, we need somebody to be on the Florida Democratic Seniors Organizing Council.
There you go. Tell them about that. Tell everybody about that.
Yeah. So I'll be calling you, Rudy. But here's something you also should know. The 6 states that are likely to decide this election, Pennsylvania, Michigan, Florida, Wisconsin, Arizona, and North Carolina, all of them have vote by mail. This is good. This is really important to know and to be optimistic about. All of them have vote by mail. But that doesn't mean that, just like Florida, somebody's just going to send you a ballot. You got to get the ballot yourselves.
That's right.
And that is the case in those states. So vote by mail, especially under the pandemic circumstances, that may be the only kind of vote that we have. It's very possible. Make sure you get your ballot. Make sure you get your ballot earlier. We win Florida. We win.
I would amen to all of that. Precisely as the chairwoman stated, that you get the ballot and you got time to really look over it. I mean, my most favorite Bible quote is Hosea 4.6. And Hosea 4.6 says, "My people are destroyed. Hear me, destroyed, because they lack knowledge, not lack of knowledge. The knowledge is out there." So if you got a ballot sitting in front of you, all you got to do is www.google.com. Type in the names and read it for yourself. There's no pressure of someone, pushing you and hurrying you to try to get you through the line so we can get somebody else in and all that. And for those of you, this is my 13th year of governance, and I've been on the ballot quite a few times. I'm on the ballot now. However, for those of you that love to go down and love to go vote, it's the same thing as with an absentee ballot. You can fill that out, take it to that supervisor of election office, and put it in the drop box. Because when you go in that curtain, up to that podium and fill out your ballot, you take it over, you stick it in a box. It's the same thing, but you get more. You get to do it out of the comfort of your home. And now with this worldwide pandemic, with COVID-19, you may not even be going anywhere near a ballot. They're worried about the spread of this disease. Having that many people coming up, touching everything and being on stuff, it really puts you in danger. I want to be talking to you, not about you. I know we're probably going to get into the testing phase, but all that got to do with voting. I can tell you right now, I was on a conference call yesterday, and this is the amount of money that's coming through the HEROES Act. $3.6 billion. $3.6 billion would it be? It says for grants to states for contingency planning, preparation, and resilience of elections for federal office. So I think that's that's $3.6 billion of money coming down to that end. Now, I know the party, and we want everybody that wanted to mail it out to the entire voter roll. I think that'd be a great thing, and I also think it'd be a great waste. I reside in St. Petersburg, Florida. We have 174,000 registered voters in this city. But in our last mayoral election, probably 50 or 60,000 people voted. See what I'm saying? So if you had mailed out 100 and some thousand votes and they didn't return them, that's a big cost. But that said, we gave out the number 833-868-3352, and I even typed it in the comment portion on my Twitter and my Facebook, so you'll see it in the comment screen. But you can call it and ask for a ballot. They will send it. My family and me, we've been voting by absentee ballot as long as I can remember, and it gives us the comfort and the time to go through and be educated to what you're voting on, what's important, and to participate. Because that ballot comes, we sit around the table as a family and we talk about what's going on and we vote. You've got to vote. The Supreme Court says the right to vote is the most protected among all other rights. Therefore, it's very democracy that our world depends on. So we have to be able to participate in that. So please, ma'am, please, sir, order you an absentee ballot and vote. You do not know what's going to happen. You do not know. We're opening up now. We're getting some flare-ups. It may shut things down, but you know this, that ballot will be in your mailbox. There won't be anybody asking for your ID or saying this don't match you or you're at the wrong precinct or you need to go across town. It won't be any of that. And see, the beautiful thing about once you fill out that absentee ballot, if you don't want to mail it back, you can get someone to take you down and you can put it in a drop box at the supervisor of election, not a precinct. There's nothing wrong with a precinct, but any SOE, you can drop it in that box or put a stamp on it and drop it in the mail. But please, ma'am, please, sir, call that number, order your ballot. And if you do want to go to a precinct poll the day of, you can take that absentee ballot, surrender it at the precinct, sign your name. They can hand you a paper when you can go over there, fill it out, and stick it in the same box that you just stuck that absentee ballot in.
Thank you, as Representative Newton. That's exactly right. And I would say, but the one advantage of vote by mails is that it's mailing them out to everybody. Is that we can then chase them. We know that they're out, and we can start haranguing people to get them back in. So that is one reason that the rates go up, because those ballots can be chased instead of waiting to see if people show up. And the other thing is, a number of the counties around the state are submitting postage paid vote by mail. And I know Palm Beach County, Broward, I think Miami-Dade, and a number of other counties, the supervisors of elections are having return postage paid. We would hope that all counties do that, but because any impediment to voting is serious, and this would expand it very much. So for all of the reasons we talked about, it's important that everybody get a vote by mail ballot for safety and security, and ensuring the right to vote. So
Madam Chair, you harped on it. You've been an excellent leader here in Florida, and I guess they heard us in DC because, like I said, it says elections, $3.6 billion for contingency, which could be stamps or anything. So
And that's exactly right. That's what the Democratic Congress is trying to put through in the newest bill, which is fabulous. Well, I just want to remind everybody. Does anybody have anything else to add about by mail before we go
I just
on?
wanted to say, Madam Chair, this is the most important thing we have to say the whole time.
yes,
Yeah.
You know that I've worked every presidential election and most midterm elections in Florida since 2004.
Yep.
I can't imagine not driving somebody to the polls at the last minute
I
like
know.
they've done every single time. But it's possible that that's not going to happen.
It's possible. Yeah.
We really need to be prepared that it's going to be vote by mail. And vote by mail is good. So now I'm going to refill myself to the closing song. So excuse me for a minute, and
Okay.
you'll be right back.
And while you're doing that, I would like to remind everybody that there is 173 days to November 3rd. All right, that's 173 days. And there are 96 days to the primary on August the 18th. So time is really shortening up. And Rudy, you mentioned this earlier, that it's important to make those requests now, because supervisors of elections are going to start getting overwhelmed, and they're short staffed now anyway. So because of the whole situation. So it's important to get those requests in now so that they get processed. And as you indicated, those ballots will start being mailed out a month before the election. People will receive them at home, take their time and fill them out, and then mail them back or deliver them so that they are received in time by election day. And so on both. So just a quick reminder, only 173 days to November 3rd and only 96 days to August 18th, the primary. Rudy, go ahead.
One last thing, in case anybody wonders, they may say, well, it's an important election and I want to vote by mail, but does my vote really count? Barack Obama won by 88/100% in Florida in 2012.
Mm-hmm.
George Bush won over Al Gore by 537 votes in 2000.
Mm-hmm.
Governor DeSantis won in 2016 by 0.4%. The only statewide election where there was a Democrat who won in 2018 was Nikki Fried, Commissioner of Agriculture. 0.81%. That's only 6,700 votes in the whole state. There's 20 million people in this state. So it's really, really, really important that you vote, and voting by mail is the best way to do it. And let me get you that number one more time, 833-868-3352. I'm done with the broken record now.
But that's important, but repetition matters. Yeah, repetition matters.
And for those of you worried about my ballot and like Al say, does it count? You can track that thing from your post office all the way to the supervisor of election. They'll tell you when it was received, the minute, the second, the whole nine. So I would encourage you and impress upon you to ask for a ballot, get it, take the time to educate yourself to what you're voting on. You got plenty of time, and make sure you return it. I would shoot for 2 weeks. That way, if you get behind, you have a week. But don't wait till the last minute, because if it does not arrive by that cutoff, it will not be counted. So yes, your vote did not count, but that's because you delayed. Me personally, I take them straight down the SOE and stick them in the box. I don't know if that's going to happen. When we return back after the session from Tallahassee, everything is all different. We couldn't go knock on doors and get petitions. No one's going to open their doors. No one's going to touch a pen. Somebody else already touched it, for examination. You know what I mean? So this whole thing is different, and it's all virtual. Proof positive. You seeing us right here on Facebook, instead of sitting in front of some cameras live, being able to go back and forth. But please, ma'am, please, sir, it's your civic duty. Participate. A lot of people.
I'm going to do one last thing. Sign the ballot. Be sure you sign the back of the ballot. Yes. Rudy indicated somebody on the panel indicated the number one reason for ballots not being counted, even though it's a really minuscule percentage in the scheme of the overall ballots, the number 1% reason is people not signing the back of the ballots.
Right.
So it's very important to do that. And we need every vote to count. Now, as you indicated, Representative, if you get them in early enough, the supervisor of elections will call you, and then you can come down and cure your ballot.
That's right.
So, and the same thing for other things. All right.
They go out
John, I said there's 173 days to November 3rd, 96 days to the primary.
No, it's just background.
I thought we were going right into it because
I'm giving you some background music, Madam Chair.
Oh,
This is the most important election of our lifetime, as we indicated. If Donald Trump loses Florida, he's toast. He's stopped. We will be electing Joe Biden as the president of the United States. So
we've had some doozy technical problems today, but we're Democrats. You can't stop us. We came through, we kept going, right?
that's
And we're going to keep going until November 3rd, when every Democrat in America is going to be doing this. So we just got one more thing to say to you, and everybody who's listening, and everybody who's on this call with me. I want you all to sing along. Dun, 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 dun. Good night, Donald Trump. Well, it's time to go. Dun, 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 dun. Good night, Donald Trump. Well, it's time to go. No, 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 no. Don't hate to leave you, but we really must say good night, Donald Trump. Good night. Dun, 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 dun. Good night, Donald Trump. Good night. Dun, 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 dun. Good night, Donald Trump. Vote for Joe Biden. And all Democrats.
That's fabulous. All right. Well, that's on it. We're all going to go vote for Joe Biden. We're going to say good night, Donald Trump, and we're going to go vote by mail and make sure our health care is covered and Social Security is too. All right. Thank you very much, Rudy. Thank you, Representative Wengate Newton. Thank you, Bowser, John Bauman, from joining us from California. Thank you, Yolanda. We're so sorry we lost your difficulty, but the Senior Caucus and John, the Senior Council of Florida is going to work hard to make sure the seniors come out and are personally responsible for getting rid of Donald Trump. Good night, everybody, and thank you so much. Good night.
Good night. Good night. Good night. Thank you.
Okay.
Wow.
I know. All right.